Thank you for inviting me to this talk. I'm really pleased to be able to share our experiences from some of the countries we work in particular in Pakistan, where we've been addressing the issue of stigma against TB using this theory to action model. I'm working with a group called Global. We're based in Singapore, and we're a global health delivery and research group that works in about 20 odd countries with offices in 9 and teams on the ground that are delivering healthcare. And pretty much every one of them is actually working in TB control. And so the issue of stigma is one that we're facing in all of these different countries. But I'm going to focus in on Pakistan, where we've had the oldest TB programs and where we've been working on this issue for the longest time. And so, of course, you've been hearing some of these numbers for quite a bit during this conference, but there are 10 million people who fall ill with TB each year. 1.2 million of them die. Pakistan, as a high burden country, has about 6% of the global burden of TB. There's about 560,000 people that fall ill with the disease and about 44,000 people that die of TB each year in Pakistan. We have been using what is the socio-ecological framework to really address TB stigma and some of the other issues around misinformation around TB. And this approach really encompasses taking a broader look at engaging not just the individual, but also the community that they live in, and certainly the broader society in which we are working to address issues around stigma. So whereas at the individual level, there may be one-on-one mental health counseling for TB patients to help support enhanced treatment completion, at the community level, there's participatory methodologies that we use to engage community groups and engage communities to ensure that beyond the individual, the communities that they live in have a deeper understanding of what these issues around TB, the disease, the treatment, and the stigma associated with the disease are. And then at the very highest societal level, there are these national campaigns that people can be engaged in, and we've certainly done these at the broadest national level in Pakistan as well. And so I'm going to be able to use this framework to share some of the experiences that we've had in Pakistan. Now, one of our largest public health programs that our group runs anywhere, but certainly here in Pakistan, is the AOTbM Campaign, or the Come Wipe Out TB. It's part of the Zero TB initiative, which is a very comprehensive approach to searching for TB, treating patients with TB, and then preventing the development of TB in those patients that might be infected with what is called latent TB. And as part of this program, we really had a very strong mass awareness and stigma reduction effort, both at the, at all levels, in fact, at the national level, at the community level, and then also at the interpersonal, at the individual level. So here is what the campaign that we ran for about a year and a half, and it really focused on these 3 videos. One that was sort of informing the community, the country, about how big a problem TB was in the country, how many people were affected by it, how many people died from it. On the top right, you see this young couple, and in that particular, messaging, the woman is somebody who's about to be getting married, but she develops TB, and then the video takes you through and the family through the idea of, well, you can't and should not stop this young girl from getting married because she's had TB. TB is curable. TB can be, life goes on after TB is cured. And so we've really had a national campaign that allows us to make, make the awareness for TB at the broadest level, and the idea that there are real stigmas that prevent people from getting treated, and that society as a whole needs to be addressing these. So this was a $1 million, year-and-a-half long campaign that really helped put our Come Wipe Out TB, or AOTbM program, on the map in the country. At the second level, at the community level, we focused on community action groups. And what this really does is it engages communities, and it sort of begins to sustain local responses to addressing issues like stigma. And it just does this with a very unique approach. And we were particularly helped by the End TB clinical trial, which really needed the community to be on board to help us bring patients into the trial, have them stay on the trial for long times of treatment, so that we can develop shorter less toxic, oral regimens for MDR-TB as well. And here are what are the cured, what happens is that within these community action groups, we take cured TB patients, relatives or friends of TB patients, we take the health workers and the educators around them, we take treatment supporters, and these community action groups are formulated so that people around, around the patient and around particular, what we call hotspots in areas where we know that there are a lot of patients that have TB or patients that have MDR-TB, drug-resistant TB, we're able to generate this discussion and this understanding that is rooted within the community, from patients that have been treated, from their relatives, and from the people that have supported them through this engagement process. And so we've taken about 14 of these large groups and taken them through, lots of processes that include you interview the patients, you work with the people that the patients and the community nominates as potential leaders and members of the community action group. You invite all of these people to the meetings, and the meetings can take place on the roadside, they can take place inside people's homes. And then the community action group is initiated, and then there are these cycles of monthly meetings and activities that follow through with them. And here's an example. The lady that is gesticulating with her hand, her name's Sabah, and she was somebody who was affected by TB, and she was actually prevented by the family, isolated by the family from engaging with anybody else, including her own children. And this was largely because the family, her in-laws, had stigmas about what TB could do to them and to other members of the family. And despite this, she got support from her husband. She worked with our team. She worked with the community engagement groups, and later on became a focal person in a community advisory group here as well. And she has been able to not only work herself and her family through the issues around stigma, but also now is helping other members of the community address these issues as well. This is one of my favorite pictures. This is a patient who, in the very early days of our programs back in 2009, 2010, was part of a Photovoice project in which we give cameras to patients to document their own life and to document their experiences as they went through the treatment process for TB. So he had regular, TB, drug-susceptible TB. He was treated for 6 months, but he had a young boy with, at the beginning of his treatment, he couldn't even lift him up. And so he had his wife take this picture the day that he was well enough in his TB treatment to actually be able to lift his young boy up again, and a celebration of having gone through TB care. And we were able to publish some of this work back in 2013 to share the experience of some of our patients in their very personal lives, using these cameras to document their perspectives on treatment, their perspectives on stigma. At the very individual level, there's this need for mental health counseling. And I think it's really important to recognize that when patients are facing stigma, especially when they're sick as well with TB, it is very important that they are supported with professionals. And so we have because we have a lot of patients, we have a large group of lay mental health counselors who sort of do the initial screening and initial support and counseling. And if a patient is then seen to be somebody who requires more professional care, then they're referred on to a psychologist. So we've been able to integrate these mental health counselings and screening sessions into 6 of our largest sites, and we are really pleased with the outcome that they have been able to give us. So there's about 3,500 patients who've been through the first of these, and I wanted to make to emphasize that these we have, of course, provided this service to many more, but these particular ones, we focused on stigma reductions because these 3,500 patients were describing to us the issues and challenges that they were having with their families. And so we had directly addressed stigma and myths surrounding TB for them and how they can then engage with their families. We told them about the precautionary measures that they can take so that not only are they informed, but they're actually ensuring that they're not infecting anybody else in the families, what they can do and not do in their daily lives. And we were then engaging them and our lay community health workers, mental health counselors, with the families and the caregivers of these patients as well. And I would like to then bring to an end this last part, whereby I am talking about a patient, a younger patient, and she she was really depressed. So this is Mehnaz, and she was isolated again because she started her treatment and then was told by her father that there's no such thing as TB, or you don't have TB, stop the treatment. And then she went on to actually develop drug-resistant TB, which then required much longer months of treatment, as well as it required a lot more drugs for her to be taking every day. So we worked with her, and her families and the counselors really intervened at these different levels to be able to get her back onto treatment, to have her complete treatment, and to have her be counseled so that her depression could be addressed. And I think if there was one sort of way of summarizing where all of these different layers of intervening to reduce stigma really come together, I would really think it's the idea that you can really make a fundamental change in the life of a patient who is depressed, who is being told by family members that there's a problem around your disease, we don't accept it, or we don't want to be engaged. And you work the whole system, not just the patient, you work the family, the community, and nationally, you work the misconceptions around stigma to make sure that each one of our patients get the treatment that they deserve. Thank you very much for your focus.